might be at their ideal body weight or just slightly above. They're usually impulsive, maybe from disengaged family or some sort of trauma. But what we see here with bulimia, many are not diagnosed because it's a very secretive disease. They hide their binge purge habits. The binge could be 10,000 to 15,000 calories, and they're typically your sweets, high fat, high salt, high sugar, vomiting, or excuse me, binges. But look here, 33 to 75% of all energy is absorbed even after vomiting. So they're really not, losing all the energy that they're putting in, especially if it's 10,000 to 15,000. 90% of the energy or calories is absorbed when they're abusing laxative. They can have very high food bills because, as you can imagine, 2 times a week ingesting convenience processed foods of 10 to 15,000 calories, that can be very expensive. And here's just a picture of what this looks like. We have anxiety, so we do a binge to feel better. We have fear of gaining weight, so we purge. We don't no longer have that fear of gaining weight, but then we get some guilt, which leads to anxiety, and this cycle continues and continues. Health problems is mostly from vomiting. We have problems with tooth health and blood potassium levels, swollen salivary glands, ulcers, ulcers on the fingers from sticking your finger down the throat, constipation. So our treatment here for these individuals is to decrease the episodes of the binge and purge, and then we're going to do this multidisciplinary approach as well. So group therapy, psychotherapy, meeting with a nutritionist, same as with our anorexia nervosa. So I like this picture here because it shows us some of the symptoms that we see in both bulimia nervosa and anorexia nervosa. So both we see a blood potassium imbalance, either from vomiting or from restricting, dental decay, iron deficiency, anemia, low white blood cell count or decline in immune function, and constipation. But with bulimia, we see the swollen salivary glands, irritation of the esophagus, and stomach ulcers. And then with anorexia, we see the hair loss, fatigue, lanugo, little subcutaneous fat, lack of menstrual periods, low metabolic rate, and cold intolerance. And then finally, we have eating disorders not otherwise specified, or EDNOS. And this is a broad category of eating disorders. It's typically maybe someone who isn't at a low enough body weight, or they are sustaining their period, or they have anorexia symptoms but they maintain a normal weight, or maybe they're not binging and purging enough times to meet that criteria for bulimia nervosa. I'm going to end this video here so then we can start out at binge eating disorder with our next one.